Hello, and a huge welcome to all of you on my YouTube channel. It's so wonderful to have you here with me today. So, have you ever had a cold that just never seemed to leave? You know the one, that stuffy nose, that pressure in your face that just overstays its welcome. What if I told you that what feels like a never-ending infection might actually be something else entirely? Today we're talking all about sinusitis. Let's clear up the confusion between a simple sinus infection and a longer-term inflammatory condition. First up, let's talk about what sinusitis actually is. It's basically inflammation, swelling, and irritation of your sinuses. But we can break it down into two big categories: the short-term kind and the long-term kind. The short-term kind is what happens with a really bad cold. It's temporary. Your body fights off the bug and you get better. In some cases, bacteria can jump in and cause a proper bacterial infection. The big clues for this are symptoms that last more than 10 days or that get worse after they seem to be getting better. But for so many people, the problem doesn't go away. When those symptoms of congestion and pressure last for months, we call that the long-term kind. And here's the crucial part to understand: this is often not an active infection anymore. It's a state of ongoing inflammation. This long-term inflammation can show up in two main ways. Some people develop these things called nasal polyps. These are soft, painless growths that form from the inflamed lining, kind of like little grapes. They block your nose and can even take away your sense of smell. Other people have the inflammation without any of these growths. The lining just gets really, really thick and swollen. Now, why does this happen? For people with the polyps, it's often linked to other conditions like asthma or a serious sensitivity to aspirin. Their immune system is basically overreacting in a very specific way. And sometimes, when sinusitis is really stubborn, it can be a sign of a bigger issue somewhere else in the body. This is why doctors have to be total detectives with this stuff. So, how on earth do we treat this? The absolute starting point for treatment for everyone is nasal saline rinses and prescription nasal steroid sprays. Think of the rinse as a power wash for your sinuses and the spray as a targeted anti-inflammatory that calms everything down. If that's not enough, doctors might use a short course of oral steroid pills to calm down a serious flare-up. For the most tough cases, we now have these amazing biologic drugs that are like smart missiles that target the very specific signals causing all the inflammation. And yes, there is a place for surgery, but it's so important to know this: surgery is not a cure. The goal of surgery is to open the doors to your sinuses. It clears out the polyps and blocked pathways so that those saline rinses and medicated sprays can actually get in there and do their job properly. After surgery, you have to keep using your medications to manage the inflammation and prevent it from all coming back. It's a real partnership. So the big thing to remember is this: long-term sinusitis is a long-term condition, much like asthma. It's all about managing inflammation. If you've been struggling with sinus problems that just won't quit, please talk to your doctor. There are more options out there now than ever before. Thanks so much for watching. If this was helpful, please give the video a thumbs up and subscribe for more. See you all in the next one.